Speak sponsored by RxCardClub.com. Get a free prescription drug card and save up to 85% on prescription drugs. RxCardClub.com. Traumatic brain injury linked to heightened risk for amyotrophic lateral sclerosis. Break. The risk for amyotrophic lateral sclerosis, ALS, is higher in the 2 years after a traumatic brain injury, TBI, according to a study published online October 2 in JAMA Network Open. Break Xingxingzhu, PhD, from the University of Glasgow in the United Kingdom, and colleagues examined whether there is an association between TBI and the subsequent risk for ALS. The analysis included 85,690 adults with documented TBI and 257,070 age, sex, and area deprivation matched controls without TBI from the general population. The researchers found that during a median 5.72 years of follow-up, 150 incident ALS cases were recorded, yielding 7.05 cases per 100,000 person-years. In adults with a history of TBI, the risk for ALS was higher compared with individuals without a TBI history, hazard ratio, 2.61. This association was time-dependent, with risk limited only to the 2 years following TBI, hazard ratio, 6.18. These findings suggest that increased ALS risk following TBI may reflect reverse causality, with TBI in some individuals perhaps reflecting an early consequence of subclinical ALS, the authors write. Abstract/full text. Disclaimer: statistical data in medical articles provide general trends and do not pertain to individuals. Individual factors can vary greatly. Always seek personalized medical advice for individual healthcare decisions. And copy, 2025 Health Day. All rights reserved. Ad as a preferred source on Google. Read this next brief. Cognitive behavioral therapy reduces suicide attempts by veterans. Among U.S. military personnel and veterans reporting recent suicidal ideation and/or suicidal behaviors, brief cognitive behavioral therapy, BCBT, incidence of invasive lobular carcinoma rose from 2012 to 2021. The incidence rates for invasive lobular carcinoma, ILC, increased from 2012 to 2021 for all racial and ethnic groups, according to a study published. Heart disease risk increases for immigrants the longer they live in the United States. Cardiovascular disease, CVD, risk increases the longer US /speak. Immigrants reside in the country, according to a study presented at the American College of. More news resources to MedWatch. Drug alerts daily. Med news for health professionals. New drug approvals, new drug applications, drug shortages, clinical trial results, generic drug approvals. Subscribe to our newsletter. Whatever your topic of interest, subscribe to our newsletters to get the best of drugs.com in your inbox. RxCardClub.com. Get a free prescription drug card and save up to 80% on prescription drugs. Less than /speak.